Okay, good evening, everyone. Of course, my name is Ayanna Polk. I'm the Director of Community Partnerships here at Vital CxNs. We're really excited to bring you back here for the fall season to talk about something that's really, really timely. We understand that it's starting to get, cold a little bit, at least in the morning. It's warm during the day and then it's cold again. So with that, we know that we're getting in that season where we have to start thinking about colds, flus, and now COVID-19. So months back, we had a community convo about long COVID, sharing about what it is, what are some symptoms, and to stay healthy and safe. Now what we're doing is revisiting that information and talking about what's going on now, the information that you can use today. And we're going to bring some folks in to talk about a special project we did over the summer around long COVID conversations. So we've been in the community talking to you all, not only about what long COVID is, but how you feel about it. And what are some things that you want your care providers, the hospital systems to understand on how they give you this information and how they can make sure that our communities are well. So, of course, on the screen, you see that we have two special speakers that are coming to you tonight. One of them is very familiar. He helped run these community convos with me last season. You're going to get a special presentation from Marcky Antonio, who is not only a long COVID ambassador, and he'll go into what that is. He was a past health equity scholar with us. So I'm really excited for him to not only talk about long COVID and give you a training on what it is and how to stay safe. He'll be talking about the long COVID convo project that we did this summer and share with us the outcomes and some of the things that you've shared with us. So with that, I am excited to turn it over to Marcky for us to get into it because we know that we've got a lot to cover. And I know that you all have some questions for Marcky and for our second guest. So I am going to pass it over to Marcky.
Awesome. Thank you so much, Ayana, for the wonderful introduction. Hi, everyone. Super great to meet you. My name is Marcky. I'm originally from the Philippines, but I immigrated here around 10 years ago. Immigrated to Boston. So I consider myself very much a Boston local as well. My family lives in Alston. I worked for Vital CxNs earlier this year and last season, up until August. And I'm excited to be back here to share with you all a bit about the long COVID project we did in partnership with the Thoracic Foundation over the past few months, and then give you all some really great information co-created by the Massachusetts MA-CEAL. I'm not too familiar with the abbreviation, but I believe it's the Community Engagement Alliance, Massachusetts CxN, and they seek to sort of engage, educate, and empower communities with access to sort of COVID and also some more long COVID work. So yeah, excited to get through with the presentation. Ayana, do you mind sharing your screen? Perfect. So the official title for our project last year is Creating Vital Connections for Inclusive and Equitable Healthcare in Boston through a community-led systems change model. And this project was done in partnership with the Thoracic Foundation. But just to go a little bit, next slide, please. Just to go a little bit into the context and background of this project, it really originated from MA-CEAL, which is based in Boston Medical Center, their initial long COVID ambassador training, which I attended way back in February. And the goal of this project with the MA-CEAL was really to train community members within and community leaders within their own communities to lead these long COVID workshops to educate others about long COVID, the local resources to seek care, and what the implications are for the BIPOC community or for communities of color. And what long COVID is, we'll get to just in a bit. I'll actually share with you all the long COVID workshop itself. But our goal after this for me, after attending this Long COVID Ambassador training, I think my goal was not to really reinvent the wheel, but to build off the momentum that had been done and the important work that had been done to sort of spread information and awareness about Long COVID. And in building off of this work, our goal with this project was really not just to educate, but also to really understand community needs and to sort of push to make that identification of what does the community need when it comes to information about Long COVID, resources, etc. And our goal is really, with this exploratory project with the Thoracic Foundation, really to use the knowledge we learn to address Long COVID disparities in future iterations of the project or in future programming through our community health hubs or other programming avenues. Next slide, please, Ayana. So to get more into the project details a little bit, well, of course, we partner with the Thoracic Foundation. They were very instrumental in providing us with the funding and the resources to launch this project. Our goals were really, very similar to MA-CEAL, to host community convos that encourage dialogue on how Long COVID has impacted Boston communities, to educate, but most importantly, to learn about community identified needs through these convos. And the project timeline was really March to August. It was a pretty short project. We spent the majority of it planning and sort of thinking about how to launch it. And then we spent May to August, around 3 months, really implementing the project.
Right? And you have to get Kingston is?
Already? He just had a shot.
When do you get the...
Can you mute that person, please?
No worries. Just please make sure it might be great to check if you're muted or unmuted, just in case, so that you don't really, just in case you disrupt the presentation or we get to hear some of the things that are going on in the background, which you may not want the rest of the audience to hear. But anyways, just going forward with it.
Marky, just to let you know, we're in the back, so we'll be keeping an eye on it. So
thanks so much, Ayana.
You're doing great.
Perfect. Trust in Ayana and the team with Vital CxNs. But yeah, and then August we really evaluated and created a project report, which I'm going to get into a bit later. Next slide, please. So to go into more details with regard to the project, we use the MA-CEAL model of recruiting community ambassadors and leaders to host community convos in their communities. Each convo ranged from around 5 to 10 participants. We really wanted to make it smaller and more intimate because we felt that was the best way in which information can be spread and people can ask more detailed questions. And also it's a small and intimate group that people can feel comfortable to share their personal experiences. With a larger group like this one, it might be more difficult to do so. The ambassadors were, of course, compensated for their time. The communities we primarily covered were in Roxbury, Dorchester. I think some people said they were from Dorchester here, after Ayana asked earlier, but also from East Boston. And I think there were some communities from other places, but these were primarily, the community members who were part of these convos were primarily from these areas in Boston. The content, of course, we gave the Long COVID workshop presentation, which is adapted from MA-CEAL, which I'm going to give a little later. But we also did pre and post surveys assessing what the community knowledge of Long COVID was and how this workshop really boosted that knowledge and what the remaining gaps were. But also we wanted to assess from the community side, but also from the ambassador side, because as they're giving the presentation, they might notice some gaps or want to share some insights that they learned. And we also had a note-taking survey for them to fill out. Next slide, please. So what are the project outcomes? As I mentioned, this was a pretty small project and we really just wanted to test it to see, how can it be scaled? So we started with just 4 community ambassadors, and within 2 months, they hosted 10 community convos. Over 80 members were in these convos, and half of these convos were given to Spanish-speaking communities. Leah was one of these COVID ambassadors, actually. Worked with Leah a lot the past few months, and so great to see her again. Next slide, please. So what did we learn? We learned a lot of things, but I think across the board from all of the convos, after doing sort of a little bit more of qualitative analysis, looking through the themes from each convos and the notes, the first, of course, one of the most important, which is that language barriers and certain cultural differences pose a barrier for non-English speaking communities to acquiring knowledge of long COVID. And so we actually found that a lot of these communities we spoke to were very, very receptive to the long COVID information, and there was much interest. And a lot of people actually came away sort of thinking, oh, I might have long COVID. But they mentioned that the language barriers, a lot of these presentations are not available in English, right? Those might pose a significant barrier, also sort of health-seeking behaviors due to cultural differences. Secondly, because there are language barriers and also sort of broadly within the community, this also contributes to a severe lack of knowledge or misinformation on long COVID among communities in Boston. Sort of some people thought that long COVID was contagious when it isn't. Even though there's the name COVID associated with it, as we'll see later, long COVID is not contagious at all. And there are many reasons as to why. Thirdly, there are several major factors outside of these that dissuade individuals from seeking care for long COVID. Medical mistrust. There's been historical medical mistrust in the communities of color. Sorry to hear, Catherine, that you lost your father to COVID in April. Sending lots of strength to you. Sending my condolences as well. Thank you for sharing. But to build off medical mistrust within the some communities in Boston, there's also the trauma from the COVID-19 pandemic. Some people don't want to go in because they worry about their own health going to these hospitals, but also they worry about sort of the labels and the stigma attached to COVID or hearing COVID within long COVID. And also lastly, sort of concerns over health insurance coverage, which is also present from some people who have COVID now but want to seek treatment, right? They don't know if health insurance covers their treatment. They don't know if health insurance covers their care for long COVID. And we'll go into a bit of these details a little later, but these are just a few of the many insights we learned, but these were the primary themes. Next slide, please. Lastly, in terms of sort of future directions, perfect. In terms of future directions, our goal is really to use this knowledge to address long COVID disparities in Boston via Vital CxNs community health hub models. While I'm not with Vital CxNs anymore, I'm excited to see how Vital CxNs will use this knowledge to inform their work in the future. So super excited to see that. Incorporating a peer-to-peer model, so not just having sort of workshops with 5 to 10 people, but also having one-on-ones is also super important. And scaling this project beyond just 4 community ambassadors. If we had 10 or 20, I think we could reach a whole slew of people. But also logistically, we would need to bring in more manpower to handle the project. And lastly, sort of, we spoke about this idea of if we were to give others information of long COVID, we need to make sure that the healthcare system is prepared to handle the wealth of patients who might come into the clinic because they think they have long COVID or who want to see their doctor to sort of speak more about it, right? And so hosting workshops with healthcare providers too. And we talked about the medical mistrust. How do healthcare providers sort of navigate these conversations, right? And also from a broader sense in these healthcare clinics, can we improve their quality of care as well when it comes to long COVID? We had a lot of these questions come up, and I'm excited to see where Vital CxNs takes this work next. I believe this is the last slide of my presentation, and I'll go into the long COVID workshop in just a bit. But did you have any remarks, Ayana? And I also wanted to open it up to everyone for any questions about the project.
Yes, thank you so much, Marky, for giving that overview. I think it's going to give us a really good understanding of the conversation we're going to have tonight. Hold on one second. So I see that we do have a few hands raised. So let's kind of like check in for a moment before we get into the information about long COVID. Carl, I see your hand raised. Feel free to come off mute and ask your question.
Yes, I see this thing. concentrating on Dorchester, Roxbury, and East Boston. Now, you got the McCormick Project, South Boston, the largest project in Boston, with all those unfortunate people. What is the plan? Are we just overlooking them, or are they throwaways?
Yeah,
Yes.
thanks.
Thank you for your question, Marky. Did you get all of that?
Yes.
Okay.
Thank you. Thank you for asking the question, Carl. I believe we had some community members attending from South Boston as well. But the way this project was structured was that we recruited sort of community ambassadors from within their communities. And while we tried to get community ambassadors from South Boston as well, we did primarily get community members from those three areas: Roxbury, Dorchester, East Boston. But I think I'm not sure where Vital Connections will take this project next, but it wasn't because of not really considering South Boston as well, but in terms of the logistics of the project, we really wanted these community members to make outreach to their communities, right? And rely on their networks. And because they work primarily in those three areas, some of them were like clinical workers, some of them were community health workers, right? They would primarily work within Roxbury, East Boston, and Dorchester. So I think that was one thing that we would love to fill in the gap in the future, but because this was more of a smaller project for now, before we can build up to maybe scale, I don't think we were able to cover South Boston. But it's definitely not because we didn't consider South Boston within community that's a priority or not. Did you want to add anything, Ayana?
Yeah, thank you for that, Marky. One thing I'll add is our long COVID work. Well, it originated when we started Vital Connections in 2020. We're doing a lot of work around vaccine access and equity. So that long arc to today, we've touched on a number of neighborhoods here in Boston. So this is just kind of one phase of the work that we've been doing to make sure that folks are being seen and have access to care in this space. I'll say with this specific project, like Marky had said, we had a call for some of the ambassadors who have been trained by the Massachusetts SEAL program, and we were able to work with who responded. And it was an opportunity for us. I know usually, for example, we don't necessarily find ourselves on the other side of the bridge in East Boston, but this was an opportunity for us to expand there. So every time that we do something different when it comes to COVID, we make sure that we're trying to touch new territory, new neighborhoods. So South Boston is not lost on us. It's really about the grassroots efforts that we have here and who we connect with in order to inform their community. So, I mean, I would say if you know anyone in South Boston who's interested in working with us, I know we always have opportunities where we engage the community. So I'll definitely keep that in mind. So maybe I could follow up with you to figure out who we should talk to in South Boston. So thank you for bringing that up, Carl. And I see that we have quite a few long COVID ambassadors joining us. Just really quick, if you were a long COVID ambassador, could you raise your hand either on camera or with the Zoom feature? Because I would love to see who's been through the program. Okay, I see Leah waving her hand. And I saw that someone in the chat, Arlene, was a long COVID ambassador. So shout out to you all. I see Robin. Yeah, see, so we've got quite a few folks. Maria, yes, Miss Maria. So we've got a lot of people who have been a part of the long COVID ambassador program that have either worked with us or we know that we've seen them in the community. So thank you for joining us tonight. And when we have our larger discussion, we might tag you in. So that way we can kind of bring you into the conversation so we can hear about what you did while you were out and about talking to community members. But to make sure that we get to the training part of this, I want to make sure Marky has time to go through the information about COVID, because I think it's really important for you all to know about what long COVID is and how to receive care, how to know what your symptoms are, so you know how to follow up and take care of yourselves this season. So, Marky, are you ready to go into the presentation?
Yes, I'm happy to.
All right. I'm going to share my screen again so we can get going.
Perfect. And also, if anyone has any questions, please feel free to type in the chat. I can see it, or raise your hand. Maria, do you have a question, or was that in response to Ayana's previous question? Gotcha.
Yes, that was a hi.
Hi, Maria.
To see you,
Hello,
Maria.
everyone. Good to see you too, Marky.
Great to see you. Glad you're here. Maria, Leah, and probably Arlene as well. And there was one other person who said they did the training. You might be very familiar with these slides. It's the slide from sort of the educational workshop with long COVID. But yeah, I'm really here to present with you all sort of an educational workshop on long COVID, just to educate on sort of what is long COVID and sort of what are the symptoms, what are the impact and implications for underserved communities, and also learn about, how to seek care if you think you might have long COVID, and support and resources. We'll be diving into that today. Next slide, please, Ayana. I guess I just went over these with the objectives, but the reason the first two bullet points are there on COVID is because it's very difficult to understand sort of long COVID without putting it into the context of COVID itself. And I'm sure some of you all might be familiar with the COVID virus and sort of the symptoms, but I'll just be going over them one last time to make sure we're all on the same page on information on long COVID and how to protect and prevent against acquiring it. Next slide, please. So just before I get into things, I just wanted to ask a broad question to everyone. Thinking back on the COVID-19 pandemic, and this may be, a very, very difficult time for a lot of you all, but just wanted to gauge sort of what's one emotion you experienced throughout the pandemic, because it was a difficult time for a lot of us. Just so I make sure that we all center ourselves on what our experiences are. And so I'm aware. If you guys feel comfortable to share, please drop it in the chat. I give a few seconds. Feel free to pop in just one word, maybe one emotion you experienced. And it doesn't necessarily have to be negative, right? I think a lot of us too sort of had a lot of time with our families because we were quarantined, right? And a lot of people found joy in that as well. I'm seeing here sort of anger, uncertainty over the situation during the COVID pandemic, scared. I think fear is a common theme through to the emotions people were feeling during the pandemic. Alone, during the pandemic, sort of a lot of us were in quarantine and maybe we weren't able to see our friends or family members. Worried, yep, misinformation. That's why we're going over COVID at the beginning of this presentation too, to make sure we're all on the same page.
Overwhelmed.
Yep. Thank you for sharing. It's a very difficult time for a lot of us, I'm sure.
And when you have the shot, that's misleading because you still get sick with COVID regardless.
Right, but the shot does reduce the severity of the symptoms of COVID, and as we'll see, it will reduce your likelihood of getting long COVID in the long term. So we'll delve a little bit more into that as we go through the presentation.
When I first had COVID, there was no shots. Didn't even know I had it until I took a test. The second 2 times I got it, I had the symptoms. I had some symptoms. So, and I had the second shot after that, the second time I got it. So it's kind of hard to believe all that.
Could you repeat that again? Sorry.
What I said was the first time I had COVID, I did not have any symptoms at all, and there was no shot at the time. And what made me go get tested was because I had to get my grandchildren tested because the school wanted one of them to get tested. And I tested all of us. All of them were negative. I was positive, but I
Yeah.
had no symptoms at all. So after my second shot, myself and my granddaughter, we ended up with COVID. And then I had it again. But I'm just saying that things could be deceiving because they say it's not as bad, but it was kind of bad for me. It wasn't severely bad, but the first time I had it, it was no symptoms at all. And that was no shot.
Yeah, thank you so much for sharing. Of course, I'm not a medical doctor, so please keep this in mind. But what I do know, especially from the training through MA-CEAL, is that COVID affects people in a variety of ways. And you could be infected with COVID one time, like I was asymptomatic, which means I had no symptoms, same as you. But then I got COVID a second time too, and I had symptoms then. But whether or not that's because of the shot, I believe scientific evidence shows that the shot really does prevent symptoms. And depending on sort of your infection and when you get it, could result in a different severity of symptoms. So maybe deceiving might not be the right term, but it's definitely COVID is a very confusing sort of illness. And there's a host of different symptoms that can be got from different infections you get from COVID or reinfections. Jazmin, did you want to weigh in at all on the question? Sorry to call you out, but also wanted to ask because you were from MA-CEAL. So
I think you pretty much
yeah.
covered it, but basically everybody's bodies can react differently. I also cannot provide medical advice, but the main purpose of the vaccine is to alleviate those symptoms so that you don't end up in the hospital. But it is understandable if somebody's body might react a little differently, as has happened to you. So.
But I'm sorry to hear about your experience. I hope you recovered well, and it sounds like you're doing healthily now. So, sending much strength to you. Thank you all for continuing to share sort of your comments. For the sake of time, I'll move on with the presentation. If you have any questions at all, just please feel free to raise your hand. Let's talk about COVID a little bit before we go into long COVID. So COVID is a disease caused by a virus named SARS-CoV-2. The virus can be transmitted if you are positive for COVID through a test and you have symptoms, or if you're positive and you don't have symptoms, you can still spread the virus. It causes respiratory symptoms that can feel like a cold or a flu or pneumonia. Older adults and people who have some medical conditions are at increased risk of more severe symptoms. And COVID has presented a heavier burden on BIPOC communities, Black, Indigenous, and people of color, and also underserved communities. Next slide, please. So how is COVID spread? So there are two ways the virus, SARS-CoV-2, spreads. The first is through droplets. So when an infected person releases droplets that contain the virus, either when you sneeze or when you cough. Another is through airborne, through aerosols. And aerosols are essentially we make these aerosols when we breathe, and we make more of them when we talk, when we yell, or where we sing. Larger droplets can sort of fall to the ground quickly, and they can spread as far as 6 feet, which is why there was sort of advisory back in the pandemic for 6 feet of social distancing. Next slide, please. So in terms of COVID-19 prevention, I know we talked about wearing masks, and for people who had mentioned that wearing masks sort of felt a bit sort of difficult and sort of you didn't like the feeling of wearing masks, wearing high quality masks has been shown to prevent COVID, especially sort of the N95s, which are the well-fitting respirators, if you can see at the bottom right. A better mask is sort of wearing double masks or the medical blue masks fitted using the knot technique, which is essentially sort of you knot it around your ear. So the tighter it is, the less the droplets can flow through or can flow out. COVID-19 vaccines, we talked about, they are safe, they are effective, and they offer the best protection against becoming seriously ill, being hospitalized, and even dying from COVID-19. So it's really important, especially now, that we stay up to date with our vaccines and our booster shots, because immunity can really decrease or wane over time, and boosters increase your initial, the body's natural immune response to the vaccines even higher than they were after your initial second dose with the vaccines. Next slide, please, Ayana. Updated COVID-19 vaccines for 2024 to 2025. 1 dose of Pfizer, Moderna. I believe there's one more, Novavax, is recommended as a booster in people older than 12 years. For those who've never been vaccinated, 1 dose is given as primary dose and another dose for boosters. I believe sometimes there are two doses for boosters. Sorry, just reading through the comments. They are safe, yes. Yes, 2 doses and then 2 boosters, right. If anyone has any other questions, by the way, please feel free, type it on the chat. I'm constantly monitoring it. Next slide, please. With regard to testing and treatment, if you have symptoms of COVID, it's important that you get tested as soon as possible so you can quarantine or sort of distance yourself from other individuals so you don't spread the virus. If you're diagnosed, there is treatment. There's Paxlovid, which is preferred, remdesivir, molnupiravir. And Jazmin, can you please correct me? Does health insurance sort of cover these treatments?
I believe so, but you have to get the prescription from your provider or a referral.
Gotcha. Thank you for clarifying. Next slide, please. So bringing on to long COVID, unfortunately, some people after their initial diagnosis of COVID-19 experience prolonged symptoms. And this is really, next slide, when we first sort of coined the term long COVID, which is sort of a longer version of sort of the COVID infection. So you continue to experience symptoms even after your diagnosis of COVID-19, like 2 months ahead. Next slide, please. Some long COVID symptoms, there are many, 200 plus described. They present 4 or more weeks after the initial infection, and they last for at least 2 months and cannot be explained by an alternative diagnosis. As you can see, and we'll discuss on later, some of these long COVID symptoms mirror other infections as well. So it's really important that you go to your doctor if you believe that you have long COVID and sort of describe your symptoms as accurately as possible. Next slide, please. Unfortunately, despite this, we still don't know why some people develop long COVID, and that is an area of research that's a priority. So for the government, for a lot of sort of pharmaceutical companies and a lot of research institutes. So we still don't know why some people develop long COVID. Next slide, please. What we do know, though, is that long COVID symptoms can appear at different times for different people. For instance, you could have COVID and the symptoms never go away. Or you can have COVID, the symptoms go away, but then come back weeks to months later after despite testing negative for COVID. Or you can have no symptoms of COVID, and then the symptoms develop weeks to months, even if you're COVID negative. But one important thing to keep in mind is that people with long COVID are not infectious. So the symptoms progress and you're negative for COVID, but you still experience sort of symptoms of COVID or sort of other symptoms as well. You cannot spread COVID if you have long COVID. And though long COVID is a risk, many people, MA-CEAL survey data show that many individuals did not know what long COVID was, which is sort of the purpose of this workshop. So let's talk about long COVID. How long do they last? This one also people don't know. A lot of people recover in weeks to months. Some people report their symptoms lasting for longer than 1 to 2 years at this time. It can be debilitating for a lot of people, and the symptoms can range from mild to severe. I see one question in the chat. Why do I think COVID is coming from the vaccine? I haven't been vaccinated, but my family have, and they get COVID back to back. Again, I am not a doctor and I cannot provide medical advice, but what I do know is that sort of there might not be a correlation between getting vaccinated and getting COVID, right? Your family could, some of your family members, even though they're vaccinated, could go to different places and they could contract COVID from other folks, but that doesn't necessarily mean it's because they are vaccinated. In fact, research has shown that folks who are vaccinated have less severe symptoms of COVID-19, and it is safe and it is effective. I think someone else had a question, raise their hand.
I had a
Yes.
I
Yeah,
had a
I can hear you.
question, but did I mistakenly hear you say that if you have long COVID, you don't have COVID? Did I
So
hear
if you
say something like that?
if you have long COVID, some folks who have long COVID are COVID negative because they had the initial COVID infection and they test negative, but the symptoms still last. Does that make sense?
So then they still have COVID then, if the symptoms are still there.
So the symptoms are still there, but the virus, they're not contagious. The virus isn't present in their body anymore.
Then why do they have the long COVID then if they don't have the virus anymore?
But that's the thing. We don't know why yet. I think that's the point of research. A lot of research right now is why does long COVID still persist even after they don't have COVID? But what researchers and scientists have agreed on, and even and clinicians as well, is that people with long COVID are not infectious. I think that's the most important thing to gather from this. We don't know why long COVID persists, but the most important thing is that they're not infectious. Yeah.
Is that facts? Because it
Yes.
doesn't sound so convincing, you know? I would feel if I had I had long COVID. I considered myself to have had COVID at the time. And my long COVID was, I had a cough for 6 months. And that was considered long COVID. But to me, I was still sick from COVID. To me, I still had COVID because I was still ill from the virus or the disease. So
Did you see your doctor by any chance and ask?
Of course I did. That was my diagnosis. I have long COVID. Eventually the
Gotcha.
But to me, if I wasn't infected, then why did I still have the cough from COVID?
But that's the thing, we don't know. I think there are a lot of things in science that we don't know,
But you're really
but what we can observe. Yeah, sorry, go ahead.
So you're still really not sure if there's a fact that you aren't contagious.
We know that it's not contagious because people with long COVID do not infect others with COVID-19. Sort of they're COVID negative when they test, which means that the viruses aren't present in their body, so they cannot spread it.
If it's not present, then why do I still have the cough? That's what I'm trying to figure out. I mean, that's what I'm trying to understand.
Well, we don't know. So I can't say for sure, but I do know that there have been some illnesses in the past where, for instance, if you get a cough, you can get a cough for 2 months because there's scarring in your lungs. That could be why you get cough symptoms for a longer duration. However, I think the most important thing here is that we don't know why long COVID persists. However, it is not contagious.
Marky, and I'm gonna jump
Yeah.
in and just kind of help kind of give some context, because I know this is something that keeps coming up when we have these conversations, right?
Yeah.
You know, dealing with COVID and now looking at the symptoms that persist and long COVID, it's something that we're trying to, as a community, as a larger society, as a world, we're trying to figure out what it is, right?
Right.
We got to understand that we were introduced to this new illness only 4 years ago, believe it or not. Time has flown. I feel like we've made a lot of advances with figuring out how to, you know, limit and stop the spread. But of course, nothing is perfect, right? So again, just to kind of, because, you know, I was just kind of listening to both sides of it. It looks like, you know, the question is, if I'm still coughing, why does that not mean that I have COVID? Because of course, we have a cold, we have those symptoms, and then it stops, right? And then the cold is gone. I think the thing is with COVID is it's a little bit different, and we're still trying to do the research and learn about it. And that's the reason why we're spreading the word on what we know. And what we know so far is even if you're still coughing, right, the virus part of having COVID may be gone, but even with it not being in your body and you being able to spread it, it still has impacted your body, right? So your body is still trying to find ways to heal. And that means some people may cough for a long time. They may have brain fog, and everyone's impacted in different ways. And I think we're trying to listen to figure out like what those different things are so we can be better informed. Yeah, what Lumina had said in the chat, like your immune system, there's a lot of factors that may show up as to why your body's responding this way. But as an illness itself, as a virus with COVID and how it enters and leaves the body, we don't know. So it just takes a lot of us as community members just to keep staying informed when there's opportunities. And we'll talk about this a little bit more when there's like clinical trials or opportunities for you to talk with your healthcare system so they can better understand it. It's important that we're a part of those conversations so that way we know how this illness impacts everyone, right? But we're definitely going to get into that with the second half, because I know we've had Jazmin pop in and out, and I want to make sure we introduce her and talk about the SEAL program, and we have plenty more time to like really get into the deep dive. But I see Lydia's hand. I'm going to let Lydia ask her question, and then I would love for Marky to get back to the rest of the presentation so that way we could get through this, because some things may answer your questions, and then after that we can kind of use everything that Marky presents to really have a robust discussion about your experiences and your other questions. So Lydia.
So my question is, well, it's kind of like a comment and a question, but I was wondering, why is it that, I don't know if you guys have heard that the new variant is really out and probably a lot more profound when it comes to the first COVID, I would say the first session of COVID that we had 4 years ago. And I've been hearing from my doctors personally that, they don't understand why a lot of the CDC isn't telling people about this new COVID, because this go round is going to be worse than the second, and that those home tests do not pick up on it at all. So the home tests that we previously were using for the first COVID, they don't work when it comes to, basically you can have COVID really bad, test yourself at home, it's negative, but as soon as you end up in the hospital, all of a sudden now you have this new variant. So I'm wondering, how does that, have you heard of anyone who's had long COVID issues come in contact or get the new variant? Because I know they're telling people to still continue to mask up, even though the CDC isn't really mentioning it. And this is coming down, like I said, from my doctors, because I'm immunocompromised, so I'm constantly protecting myself. But I know of other people within the past 2 weeks, 5 people have had this new variant that I know of. And it basically just came unannounced. And when I say unannounced, I mean no side effects, no nothing, until they're in the stage where they have to be in the hospital.
Yeah, thank you. Thank you for asking that question, Lydia. I think given this is a new strain, I think the CDC is working overtime to understand what this new strain is, sort of whether the home tests are accurate to test it, as you said. And I'm sure it can be pretty scary and overwhelming to hear about this new strain and not know much about it, especially given you're immunocompromised. I'm not sure, Jazmin can correct me, of hearing about sort of long COVID patients contracting it. But I think the most important thing is that as these new strains pop up, it's really important that we sort of get our new booster vaccine, that we sort of protect ourselves and others by testing if we have symptoms, and when we're in crowded spaces to wear masks and try to
And
protect
I'm
ourselves as much as
I'm
possible.
similar to you, not to cut you
Yeah.
off, but I'm similar to
No,
you.
please.
I'm asymptomatic as well, even though I'm immunocompromised.
Yeah.
Before I was immunocompromised, I was asymptomatic to a lot of things. To
Right.
where people around me was getting sick, but it wasn't hitting me, but yet I could carry it. You know what I mean?
Right.
It was strange, but that's why my question was, and my comment is what it is, because like I said, 5 people in the past 2 weeks, they have had this new variant. And the doctors did say it's undetected with the home test.
Gotcha. I believe I also saw some research that said, not really undetected, but that there might be a delay in getting positive cases. But, in keeping up with the research as well, it's good to continue reading on the news for what it might say. And as soon as we get new information, sort of, in our long COVID workshops, we'll make sure to add it in. But thank you for putting this to our attention, Lydia. And I hope you're doing what you can to protect yourself as well. And I hope that the 5 individuals around you who contracted COVID are sort of recovering well, and regaining their strength. I think it's super important, just for the sake of time, because we want to make sure we get to sort of MA-CEAL and talk a bit about it. I'm just gonna go through these a little quicker. So do other viruses cause long-term symptoms? As we talked about, long COVID mimics other sort of viruses and other conditions. So that's why it's important to go to our doctor if we believe we have long COVID. Next slide, please. Potential ways it affects our body, sort of cells might be infected, changes in immune system response, persistent inflammation. We talked about sort of why the symptoms might continue. Maybe the immune system particularly feels inflamed, and so you continue to feel sort of fever even after having COVID, or headaches or the other symptoms. There are many. So for hospitalized patients especially, it could be part of a prolonged recovery phase after a critical illness. Next slide, please. But beyond the symptoms, sort of, oh, Suzanne, you said you had a question. Would it be okay if we get to it in just a bit? I'll make sure I get through the entire presentation, and maybe parts of the presentation will also answer your question. But if
Okay.
not, please feel free to ask it afterwards. Thank you so much. In terms of the implications of long COVID, sort of there are many implications. Long COVID can be debilitating for a lot of people. So sort of it may lead to decreased work productivity, people on disability leave, a sense of isolation, feeling you're not understood and you're sort of suffering through this condition on your own. There are also low health literacy in some communities of color, which means sort of the ability to read, produce, and apply health knowledge. Next slide, please. But the implications of long COVID, we also have to understand who is at risk for long COVID. So who is at risk for long COVID? Primarily the folks who are at risk for more severe symptoms of COVID. We have found that women are at higher risk for long COVID, patients hospitalized with more severe infections of COVID-19. So it's really important we get our vaccines. People who need additional oxygen, people with medical conditions who are, again, more likely to get more severe COVID-19 infections. Next slide, please. But the other factors beyond sort of speaking demographically, reinfections, if you get COVID-19 multiple times, you can have a higher likelihood of developing long COVID, but also socioeconomic risk factors. Lower income neighborhoods have particularly high burden of COVID-19, especially during the pandemic. So higher likelihood for getting long COVID because there are higher cases, and also lack of ability to adequately rest. If you don't give your body the time to recover when you have COVID, that can also lead to a higher likelihood of getting long COVID. And I'm going to answer all of the questions in the chat and the comments coming up in a bit. Let's make sure that we get through this presentation. As I mentioned, higher burden of COVID-19 among BIPOC communities, And especially for some communities of color, their life expectancies are shortened by 2 to 3 years. For Black individuals who have COVID-19 infections, life expectancy shortened by 2 years. Next slide, please. Fortunately, though, the long COVID rates in the US is decreasing. Early reports from the CDC had showed that nearly 20% experienced symptoms of long COVID, but in mid-June 2023, the figure has decreased to sort of 6%. So it's sort of shown a decrease. In terms of information now, there is information available, but this is as far as we know from mid-June 2023. Next slide, please. Long COVID rate, unfortunately, also has a disparity. It's higher in Latino or Hispanic and Black adults. Next slide, please. Another study showed that a majority of patients with long COVID were white, non-Hispanic, female, and more likely to live in affluent areas with greater access to healthcare. So it just shows sort of the wealth of research. And there isn't 100% a consensus yet, but there are trends that people have shown in the data. And sort of if you want to read more on the research, sort of, I believe this presentation is available on the Massachusetts CxNs website, right, Jazmin? This presentation?
Yes.
Perfect.
And in Spanish.
And in Spanish. Amazing. We just talked about the language barriers earlier. Next slide, please. But something to think about as well is sort of, are BIPOC community members aware of long COVID, right? Is there a difference in who has long COVID and can access long COVID care, sort of the equity portion? And what are the barriers to accessing care and how can we overcome these? All of these questions really we've addressed in sort of our project with the Long COVID Ambassadors, which I talked about earlier, and also the Massachusetts CxNs initial project, the initial Long COVID Ambassador project. Next slide, please. There are just many barriers to health equity and care. There are many economic, occupational, it really depends on the individuals. And so understanding these will be really important in informing how we tackle sort of long COVID disparities in the future. Next slide, please. And other reasons leading to long COVID inequity, mistrust in medical system, the spread of misinformation, which is why it was really important today that we go through COVID information first. And I'm glad to see everyone asking questions and putting comments, and we would love to address them in a bit because we would really love to encourage and sort of open dialogue on what people have heard about COVID and have personally experienced, and how can we sort of fill in that gap between what they have experienced and sort of what does the research say, what do clinicians say, what do health experts say. But there are also disparities within the healthcare system, right? Our healthcare system isn't perfect. And also a lack of recognition of long COVID by physicians, either due to sort of a lack of knowledge or because maybe it mirrors other diseases. So there are many different factors. Sorry? If you have a question, we'll get to it in just a bit. If you want, you can put it in the chat and I'll make sure I read it as we move on to the next section. However, there has been, next slide, please, an influx of long COVID clinics throughout the greater Boston area. MGH has one, and then the Boston Medical Center has one as well, and a bunch of different medical institutes also that have really erupted to, that have really sort of been created to deal with this new influx of long COVID cases, right? Because we talked about how it's sort of similar to other conditions, how physicians might not be able to recognize it so readily, and how the symptoms are just so much, and they sort of 200 plus were described, and they span a number of different they impact a number of different areas of the body. Some people get headaches, some people get rashes, right? And so these long COVID clinics have really sort of been on the rise as they present sort of a more multidisciplinary, more holistic way to care for these patients, looking at it from multiple angles, right? Like cardiology, looking at the heart, or neurology, looking at the brain if you have headaches. And they're also contributing to sort of more research to understand long COVID better. Next slide, please. But because we presented a lot of information on long COVID and sort of its implications for communities, and sort of maybe as you're hearing this, you're thinking, oh, I might be experiencing some long COVID symptoms, or I might know someone who might experience them. Let's delve a bit into really quickly on what to expect when you see these long COVID clinics, just to make sure that you all feel prepared if you want to sort of encourage your neighbor or your peer, your family member to go, or if you feel motivated to go yourself. So what do we expect? Well, patients receive individualized care, which may include a host of different examinations and tests that's really contextualized to what they're experiencing themselves in terms of their symptoms. Next slide, please. When do we seek care? You should always go through your trusted physician or your primary care physician. If you have symptoms after your initial COVID infection that last for longer than 4 weeks, care is recommended, especially if it's moderate or severe your symptoms and they interfere with your daily day-to-day activities, right? Most mild symptoms that do not interfere with day-to-day activities are expected to improve over time, but if you feel concerned, you should go talk to your primary care trusted physician. Lastly, it's important to note that all patients are evaluated regardless of symptom severity. Next slide, please. Resources for these, how to prepare for long COVID appointments, are available on the Massachusetts CxNs website, but we'll also post it on the chat very soon. How to prepare for your long COVID appointment, and in general, I think this is also sort of generalizable to your other appointments, right? Prepare descriptions of the best and worst days of symptoms, make a list of all current medication, make a list of questions. And after the appointment, make sure to keep track of your symptoms to schedule follow-up appointments if you need to. Next slide, please. And if your appointment is a telemedicine visit, I know it's for some folks it might be difficult to find a place with good Wi-Fi. Make sure you have access to a phone or a computer or internet access. Maybe you can go to a public library near you, and ensure that you're in a private location so you can talk freely with your doctor. So if you're going to a public library, maybe finding a room, a private room there, or going to a place that's sort of maybe more private where there aren't a lot of people. Next slide, please. In terms of living with long COVID, we talked about multidisciplinary care. So part of the long COVID clinics too is sort of helping folks who have long COVID or who have the diagnosis sort of deal with long COVID, right? A 2021 study has shown that 6 months after having COVID-19, many adults had anxiety, low mood, insomnia. And earlier you all talked about sort of the negative symptoms you experienced during the pandemic, right? Like isolation, loneliness, and it can really lead to poor mental health. But seeking care, with your primary care physician, having good communication networks with your friends and family members can really help folks get through, a very difficult diagnosis. Next slide, please. The last thing, which I really want to emphasize, is the vaccine can decrease symptoms if the patient has long COVID. And the vaccination may prevent the development of long COVID in the first place. There is a correlation between folks who are unvaccinated and the likelihood of getting long COVID. And lastly, about treatment, Jazmin said that you do need to get a prescription, but Paxlovid and other treatments are covered by your health insurance. If you have COVID-19 infection and you treat it with Paxlovid, it also may reduce the risk of long COVID. So it's really important to seek care and talk to your trusted physician if you're concerned about your COVID symptoms or acquiring long COVID and whatnot. Lastly, to really hammer it down, reminders for patients with long COVID and also for all of us as well. It's really important to be patient, get vaccinated and boosted for new breakthrough infections. As Lydia mentioned, there was a new strain, get treated if you're eligible, ask for medical help, follow through with your doctor's recommendations. Lastly, be informed. And as we've seen today, which I love the active engagement, don't hesitate to ask questions. The next slide is just a slide for questions. I wanted to give the mic back to Ayana to see where the conversation can go, whether this will be a Q&A portion or we'll have a panel with Jazmin. Just sending it over to you, Ayana.
Yes, thank you so much, Marky. I think that the presentation about the project was awesome, as well as giving us that information, because, in true Vital CxNs fashion, we love to have these community convos. We want to make sure that we're setting the stage and everyone has an even playing field of the information. So that way, as we start to ask questions, we at least inform of what we know that's going on right now. So before we get into, because I was watching the chat while I was doing the slides, I was trying to listen to Marky and take down notes. So I know we're going to get into a bit of conversation about this, but before we do that, I want to bring someone who was already kind of chatting with us to the virtual stage. And that's going to be Jazmin Granadeño. She's the community engagement specialist for the Massachusetts SEAL team. And forgive me, I just want to make sure that I give you the time before we get into the second half of this to share a little bit about yourself, share a little bit about Massachusetts SEAL, and what we always love to do when we have a speaker come with us on our community convo journey is not only just share a bit about who you are, but what brought you here, what makes you passionate about the space that you work in. And we would just love to kind of get to know you a little bit before we get back into the conversation about long COVID. So Jazmin, the floor is yours.
Hi, thank you for having me. And you covered it all. I'm a community engagement specialist with MA-CEAL is how we abbreviate it. And so a little bit about myself is that I am Latina. My parents immigrated here from El Salvador. I think it was in the 80s. It was fleeing from the civil war in their country. And so a lot of what inspires me a lot to do the work that I do really stems from my family's experience being in this country. And so some of those things include like language barriers, just having access to care was very difficult back in the day. And so a lot of that really shaped on what I wanted to pursue in my career academically. And so that's one of the reasons why I got my master's in public health, because I wanted to learn how to address those barriers and what kind of strategies are needed to make those changes within our systems, basically, because I feel like a lot of the issues are systemic. And so that kind of aligns a little with a lot with the work that I do with MA-CEAL and our commitment to achieve health equity by addressing those factors. And so a little bit about MA-CEAL is that it is one of the teams out of 21 teams across the regionally for a community engagement alliance that was funded by the National Institute of Health. And so they started in 2020, and from 2020 to 2023, they were focused on addressing the impact of COVID-19 pandemic by spreading awareness to address that misinformation, spreading education on COVID and long COVID and other resources as well, and also conducting inclusive research to support people in communities of color. And so hopefully with them, in order to do that, we have to include the community in the process and include their voices in trying to figure out how to address these, because without the community, we don't know how to address these. And so that's kind of my role, is building those relationships with community organizations, with community members, and linking them to these resources and opening up some opportunities for participating in research as well.
Awesome. Thank you for sharing a bit, because I know we've done quite a bit of work together in the COVID space, and I know Marky has shared a lot about the ambassador program. Could you share maybe a little bit from your vantage point about the project itself and maybe your experience with working with community members around long COVID?
So the Long COVID Ambassador program, I was a master trainer along with my colleagues, Shakira Robinson and also Hope White. We basically identified community leaders from among the community. We were trying to figure out who would be interested in leading these long COVID workshops after, taking the training, because they are the ones who are in their community the most. They know where to go, where to spread this information that is needed. And I see a lot of familiar faces and names in this group of some long COVID ambassadors who have really helped us spread the word on long COVID and the impact on that. I feel like every time I go to events, somebody comes up and they talk about long COVID, or they know about long COVID already. And so I find that very exciting that it's work to spread that word. And so this project was led by Dr. Zai Marate. And so she is also the one who leads the recovery long COVID clinic at Boston Medical Center. And so through her leading this program, because they realized that, the communities impacted the most by COVID were people of color. And so you see the effect. If there are a lot of people impacted by COVID to begin with, then that means there's a lot who may be impacted by long COVID as well. And so that's a little bit about our program.
Awesome, thank you. Because I know during our time working together, while the ambassador program was going on, and then when we kind of got the baton this summer, I know you've all been doing a lot of great work. So I just wanted to give a minute for you to kind of explain what the program was, because we know we've got a lot of ambassadors here. So thank you for kind of sharing that and setting the stage. So I know I'm kind of looking at some of the questions that we have prepared and kind of comparing them to the chat. So I'm going to kind of bounce back and forth so that way we can try to cover as much ground as we can before we end tonight. But I would love to kind of think about some of the things that I've seen and a lot of the reactions that we got. And I think going through the data from this summer and even talking to folks between that time and tonight, right? A lot of the same themes come out about what the community thinks and feels when it comes to getting care for long COVID or for other illnesses, right? There's, questions about, is this care really, accessible to me? Is the information I'm getting true, right? There's a lot of misinformation floating around. And even with talking about trusting the medical system, that's a whole nother conversation within itself, right? So I know as two folks who have kind of led parts of this long COVID work in the community, what are some things that that you hear from folks that are trying to find information or treatment, or just to have a better understanding of how to navigate the healthcare system?
So I feel like a question I saw was about the new strain. And I just wanted to talk about that. I just think that it takes a little bit of time for them to actually see the trend. Because even with the COVID that started in like March 2020, people were getting it in December 2019. So it did take some time for it to be noticed. And I think eventually we will see, the CDC and other institutions bring out those stats about what's going on with this new strain. And so it's a lot of waiting, but I think eventually they will, share that information that they've gathered a little bit, if that's any reassurance.
Yeah, thank you for that. Because I know a lot of times, especially, I even think about my experience of sitting at home trying to figure out what's going on out there. A lot of times, organizations like the CDC want to make sure that they're giving out the most efficient and true information. So sometimes, especially when we think about new strains, new vaccines or whatever is new, there's a lot of checks and balances that go in between the time that something is first discovered to when we get that information out to the public. So I definitely want to kind of like say check to that, because I understand that sometimes it's a waiting game, but I think a lot of folks are trying to make sure that the information that they're sharing is the most, you know, true to what's going on. So definitely receive that. Marky, what about you? Are there some things like in the community that, you know, folks, you know, have been sharing, or something that you think kind of comes top of mind when you either think about your time getting the training or working with the ambassadors this summer?
For sure. Thank you for passing the mic on, Ayana. I just wanted to affirm sort of what Jazmin and you said. I think science and health and sort of health information specifically is always progressing at a fast rate. And so, you know, the CDC, health institutes, medical institutes are really trying to keep up and up to date with their information. And sometimes there's a delay, right? Because they want their information to be as accurate as possible. I mean, every year we get a new sort of flu shot, right? And that's because these viruses are constantly mutating. And sort of the year's worth of research is sort of identifying how do we prevent, how do we prevent, and how do we sort of identify what are these new strains of viruses and what are their sort of the surface proteins, and how do we, you know, all of those scientific things. But I really wanted to also sort of speak to the fact that the rapid pace at which health information is changing, and also now with the spread of misinformation on social media, one thing I've really been seeing is that a lot of people can get really overwhelmed, right? Especially with their own experiences. And sort of from what I've heard today and sort of read, there's really that gap in sort of what the health information says and what you read online, whether because of misinformation or like what the CDC says versus what your personal experiences are with the healthcare system. And I know that can be very frustrating and overwhelming. So one thing I really wanted to do was just validate everyone's experiences. I mean, I have a severe bleeding disorder. I have hemophilia, and sort of living with a chronic disease, it's sort of difficult to envision what your day-to-day looks like, because one day I'm completely fine. The next day I need medication, right? Because suddenly my limbs started swelling, right? Because of bleeding in there. And I don't know what happened to it, right? And sometimes even the doctors don't know, and that's okay. You know, I think it's just as important to say what we don't know than it is to try to say something that we know. And I know my body very well. Sometimes I don't even know what's going on, right? And it can be very scary and overwhelming. But I think the most important thing is to really sort of reach out to your doctor and sort of trust your doctor and do as much of informed research as you can, reading sort of credible news sources and sites. And I think one last thing I wanted to add, because I don't want this to be too long too, and I really wanted to add too, when we talk about trusting our physicians, a lot of people have talked about you sort of distrusting and mistrusting, their feeling of mistrust within the healthcare system, right? And I think one thing we need to address within the healthcare system is sort of the historic legacy of mistreatment on certain communities that the healthcare system has done. And this mistrust can often be very deep-seated. And I think, you know, as an aspiring doctor and someone who might go to medical school soon, I think for me, being Filipino and coming from sort of abroad in the Philippines, where we trust our doctors a lot, I hope to bring this experience with me, but I also hope to see more of a shift in training our doctors to be more culturally aware, to validate their patient experiences and be aware that some of the patients come in not trusting their doctors because of bad experiences they've had with their doctors in the past. And I'm really sort of excited with the work and sort of pushing forward, hopefully pushing forward to have these more culturally sensitive experiences. But I also know that the folks over at MA-CEAL and BMC are doing important work on their end to sort of advance education on long COVID, especially for physicians who might not know much about it.
Yeah, thank you. And see, just like you said, it aspiring doctor right here. I can't wait to see what you do, right? Let me know when you're taking patients. Because I think it's really important. And I know particularly for this community convo, I really saw that it'd be important that we gave space to you know, budding professionals, because it shows that you could be an owner of information at any age, right? At any space in your journey. And I've seen a lot of great work from Jazmin and Marcky with leading our Long COVID Ambassador. So I just want to say, one, I want to tip my hat to you and just say, like, in this space, thank you for all the work that you've done and all the work that you're going to do, because we know it's important that you not only bring your lived experience and your stories, because you shared about like your health, you know, where you've come from and your families and what you bring to this work. And it's really important. So I just want to say, just give a moment here just to kind of just say thank you for all the work that you're doing, because it's great. So, yeah. So, you know, I think, Marcky, you kind of touched on something. I wanted to kind of get into medical mistrust. So I'm kind of happy that you brought that up, right? Because we see in the chat a lot of folks are talking about going to their doctors and not feeling heard. You know, just kind of either getting misdiagnosed or put off when it comes to you know, when they're advocating for care. And I know we talked a bit about, you know, tracking your symptoms, writing them down. But what are some recommendations that you have for some of the community members here who go to their doctor and want to have those conversations about some of the symptoms that they're feeling? Now, we know that there's like the Recover Clinic and other spaces in Boston where you can get seen for long COVID, but I know that you got to kind of go to your primary care first. So before we get to that step with the clinic, how about let's talk about a bit about what we can do when we're in those conversations with our primary care doctors. So if either of you have recommendations about what that can look like, that would be really helpful.
I think one of the things that is also in the slides, but something I've seen also in an organization called We Got Us, they have a document that helps people have the conversation with their doctor. And I thought that was amazing because sometimes when we go in there, we don't know how to talk to them. They just ask us a bunch of questions and we're just answering those questions, but we can also lead the conversation as well, especially if we have a bunch of concerns. And so I definitely think writing down, you're keeping track of your symptoms, how you're feeling, how that compares like another different time point, your medications. And if your doctor doesn't hear you, I recommend looking for a second opinion. You use your better judgment on that, because I think you have options to, you know, get the best care that you need. And if it's another person, then you could try that as well. And also just share with your network what you feel safe sharing with, because sometimes they can also give you advice on some of the things that are going on, especially they could be your support system too. And so I would say the best thing is probably keep track of everything. Document everything that's going on with your body and have that conversation with your doctor. And don't be shy. If you need something, you gotta let them know, because they won't know unless you share it.
Awesome. I do see a hand raised, Carl. Carl, your microphone's a little muffled, so it's hard to hear you.
I just want to bring out something that I've noticed with just about every medical since anything.
Carl, I'm sorry, it's a bit difficult to hear you. Sorry if I'm interrupting.
Yeah, Carl, I think your microphone's breaking up a bit. If you're able to, could you type your question in the chat and we could read it out to the group so we can answer it? Okay, so we'll keep an eye out on the chat for Carl's question. but I think that's important too, Lydia. I see that in the chat, she put that she also does the surveys after her doctor's visits too, to share her experience, which I think is really important to let to kind of let the hospital or your health center or your healthcare center or wherever you're going know about your experience, because that information is used to kind of inform how they work with community, right? And I know at least here at Vital Connections, we've worked a lot with folks in the healthcare system, like BMC with SEAL and the Recovery Center. We've worked with a lot of folks, so that way it's not just about them reaching you, but you're telling us and them what you want and how you want them to show up. So it's really important that you find ways to share how you're feeling, so that way we can have better connections. Suzanne, I see your hand up.
Yes, just a quick one. It was just being part of this meeting that I've had a recollection and thinking about, COVID and it continuing on. As a child, I had whooping cough, and afterwards, whenever I coughed, I still had that same reaction for a number of years. And it just what people are going through, and with COVID lasting a while with symptoms, it just, made me think about that. If it's something with some diseases that prolong. That's it.
Thank you for that, Suzanne. Marky, Jazmin, do you have any kind of response to what Suzanne had shared?
I mean, I think, Suzanne, thank you so much for sharing. I think there are just some illnesses. Again, we don't know truly what causes long COVID, but there are also some illnesses just persist, right? You're talking about whooping cough. As a kid, I had allergies, but then I don't have allergies anymore as I'm older, right? And we still don't know why. But I think it's important sort of to understand that sometimes when, even though we don't know why, sometimes we know the outcomes, right? So we don't know why long COVID happens, but what we do know is that the virus is no longer in your body when it happens. So we're sort of like navigating this boundary between, what do we know and what do we not know? I think the most important thing, as we talked about earlier, it's just as important to say, I don't know this, than I know that, right? But really appreciate you for sharing your experiences. Jazmin, did you want to build off what I
just wanted to add in that the Recover Clinic was conducting a study where people who came in, they would ask them, it was voluntary, they would ask them if they wanted to participate in the study. And so we may see those results in the future about those effects of long COVID and understanding a little more about long COVID, more than we do now. So I feel like we'll see it soon, I'm hoping, but they're still studying it right now, unfortunately.
Thank you for that. And thank you, Suzanne, for sharing. So, still, Carl, I know you still might be out there. If you can, feel free to put that in the chat, because I know we had trouble with your microphone. But I do see Jacqueline put in the chat, what do I do if my doctor is not listening to me? I think I would just go back to what Jazmin said, that if your doctor's not listening, get a second opinion, right? It might be an opportunity for you to find someone else. If it's like a health center, there might be other doctors that you could ask there, or try to find folks that are in your network, in your insurance network, to take a look at your symptoms, and that might be helpful. But with thinking about that also kind of brings me to another point that we had seen in the slides really early, that some folks, when we think about access to care, we have questions about insurance, right? And I think that can be a really big barrier to care. So wanted to also give space for you all to kind of talk about how can someone who has either limited or no insurance kind of navigate the system, if you have any insight to that.
I would like to add just one thing about Jacqueline's question is you could also, if you have like somebody you trust, join you in your visits. I know that sometimes, like, for example, my dad wouldn't want me at his visit. And so just pick somebody who you trust to just be your ally there, to support you there. And if that doesn't work, there's also a second opinion as well. And just to also go about the whole health insurance, I know that Boston Medical Center offers support on getting health insurance. They have someone who can connect you to either their health insurance or possibly Mass Health. But they do have some navigators there to connect you to those resources. So that is one way to approach it. I do know that from what I've heard from even while I attend events, people are having struggles to get health insurance. And so we've been trying to think of how to best connect community members who need it to I feel like it's really complicated because, you know, they have so many eligibilities and they're all very different. So it's just, we're definitely thinking about what's the best way to do that. But I know for the hospital itself, they do have some navigators who do that.
Thank you so much. Thank you.
Yeah, I think that that's something that comes up for a lot of folks, right? It's like, whether you know what kind of insurance you have or whether you have it or not can really dictate what care looks like for you. So I think it's really great that BMC has folks there that are able to kind of help navigate that system for people because, you know, I feel as though if we're all not well, right, there's still opportunity for folks who are not being seen to continue to get COVID or have those persistent symptoms that turn into long COVID, and you know the community at large is still suffering, right? So I think it's really great that BMC takes that approach to make sure that everyone has the opportunity to be well. So thanks for shouting that out. I would say, you know, I think we kind of covered this because I feel like a lot of my questions have kind of been asked or answered through this conversation. So I may open it a bit up for folks here on the call. But I would say, what are some, you know, some, I guess, advances or some bright spots that you see with COVID research? You know, are there new, are there new vaccines? Are there new organizations that are kind of stepping in the gaps? I know that we're doing it with working together, but wanted to know if either of you knew of any like new things that folks on the call should know about before we open it up for questions.
I think Marky already mentioned this, but the FDA did approve and authorize a new booster for the fall. And so I've already heard that people have already started to get their booster, and I'm like, so quick. I'm like, I haven't gotten mine yet. And so I was very like surprised how some people are already gotten their flu vaccine, their booster. They're just getting prepared for the fall because that's where, unfortunately, is the rise of the cold, the flu, just now COVID. And so it's just better to prepare yourself. So the Novax is the new one that's available now.
I had even seen, I went to the pharmacy and they've got COVID shots available, like COVID vaccine available, flu shots available. So it's definitely becoming something that we could find close to home. So that's definitely something that's great, because I remember when everything first started and the first vaccine came out, and I know I was looking for it, but it was like, you know, it was a whole different story. But now we can go around the corner to, you know, our CVS, our Walgreens, our Targets that offer vaccination and get that. So that's another really local accessible option. So good to know that. Before I open it up, Marky, is there any kind of silver lining in all of this COVID and long COVID talk that has come across your way?
Yeah, I think there's much silver lining. I mean, Ayana, you just talked about sort of the number of public health services that are now available to folks. You know, Jazmin placed in the chat that Paxlovid, I believe, is free if you don't have a PCP. In Massachusetts, there's testing services available. Sort of nonprofits like Vital CxNs are doing very important work, sort of spreading health information and health knowledge on long COVID. And I think it's very positive how there's a lot more funding being directed from the government and even from other institutes, right, into long COVID research. I think one really positive news I've heard recently is that some folks with long COVID, they've found have really strong immune memories even after their infection. Like 2 years after the infection, they still have really strong antibodies within their system that can help fight off reinfections and whatnot. So that just goes to show this rapid pace of sort of research and information. And I think lastly, I want to bring up that sort of one silver lining has been that God forbid if there are any new viruses or future pandemics, I think we are very much more well equipped to tackle these. Our public health systems are much stronger, our healthcare systems are much stronger. And also, you know, with the mistrust issues within the healthcare system, sort of this new wave of long COVID has been exposing a lot of those, the mistrust within the healthcare systems. And I think there are a lot of folks and institutions like We Got Us, which Jazmin sort of mentioned, that are actively taking steps to sort of mend those broken relationships within the healthcare systems and community members. So I think there are many positive things to take away, in spite of sort of some of the negative, the more sort of disheartening things we've heard about long COVID from this conversation.
Yeah, awesome. Thank you for sharing that, Marky. Oh, because I feel like I can go on forever. So I definitely want to like take a moment here, right, to kind of open it up for folks. I know we've been having things in the chat, and I know a lot of people have been listening and maybe thinking about other questions that they have. And I want to give you all the opportunity to, you know, talk to Marky and Jazmin. So if anyone has questions, feel free to raise your hand. That way I can kind of call on you. So that way we can take more of your questions while we're here. We've got about 20 more minutes. Or feel free to put them in the chat and then I can read them out. So we can do it either way. So yeah, going to open up the floor. Does anyone have questions that we haven't covered yet? Okay, Caitlin put something in the chat right there. What treatment options are available now when it comes to COVID, I believe. Caitlin, can you clarify what you mean by LC? Oh, long COVID, thank you. So what treatment options are available for long COVID now? And I know in the chat, she kind of shared about some of the experiences that she's had with doctors giving other medications rather than the ones that may address the immediate symptoms that she's having. So when it comes to treating long COVID, what does that look like right now?
Yeah, I think I'm happy to just kickstart this off, Jazmin, because I think we went over it a bit in the long COVID workshops. I believe that the treatment available right now is is towards managing the symptoms holistically. So we talked about how long COVID has a whole range of symptoms. You can get headaches, you can get rashes, you can feel fatigue within your body. And so I think the treatments for long COVID right now are to help ameliorate the symptoms in the long term. So going to physical therapy, rehabilitation, to taking medications like pain relievers, and also broadly, like some folks experience sort of mental health difficulties because of their experiences with long COVID or with COVID. And so seeing sort of getting cognitive behavioral therapy, or seeing someone who, like a therapist, who can help talk you through and communicate about sort of how to manage sort of anxiety or any mental health difficulties. I think they're really towards ameliorating the symptoms. Jazmin, do you want to?
Yeah, you kind of covered it. I was just gonna say that once they identify what your main symptoms are, that's when they kind of can tell you which area to go to, which therapy to have. In particular, there isn't, from my knowledge, I don't think there's like one drug for all kind of situation. I think they're still studying what works best, but I think for right now, it's more of the doctor, assessing your symptoms and then taking you to the best department.
Yeah, that makes sense, because COVID is not one size fits all. So I think the road to recovery looks different for a lot of different people. I see Leah, I see your hands up, and she was another long COVID ambassador. So would love to hear your question.
I remember they were closing down some of the long COVID facilities. So have they reopened them with this new variant, or what's happening with that?
I had not heard of that, but I know that the Boston Medical Center one is still open. But I can definitely, because we have like a flyer that has all the clinics. I can definitely double check all of them to see if they're current. And I can definitely, some of these questions, the ones that we can't answer, I can definitely bring them up to Dr. Marate. She may know more about what's going on with the clinics.
Okay, thank you. Because I don't want to tell people, people keep to try to get into one if they're not, able to do it.
Definitely.
Yeah, definitely. Because I know with long COVID and, just with time going from 2020 to now, of course, some initiatives, because, COVID isn't as, scary or pressing, and we kind of have it a bit under control for the population at large. Some folks have shifted to other spaces, so there aren't as many clinics or opportunities to be seen. But it's always good to stay on top of that information. I know I put in the chat the link to that flyer that Jazmin was talking about, and we'll make sure that when we send the wrap up, we'll send you a video of all this. So if you want to share it with your friends or your community, this way you can kind of share the information with them as well, but we'll give you everything you need to pass that along. So we'll make sure that you have all of that. So, and I just want to just say shout out to Leah. I know I sat in on one of her long COVID convos. We talked to some people together. So thank you for all the work that you've been doing, Leah. So thank you.
Trying to get off of mute here. You are so welcome. I loved hanging out with you. And, anything to help my community, to spread the word, to keep us safe is always a pleasure. So
yes,
thank you.
We appreciate you. Yes, we appreciate you. So, okay. Yeah. So, I would say, I know we're kind of getting closer to the 8 o'clock hour, but wanted to know, kind of put it out there, if anyone else has any other questions for Jazmin and Marky, because I want to make sure that I give you some next steps, because I think that's the important part. It's always great to talk, but I'm an action kind of person. So I want to make sure that I kind of give you some things that you can do for your communities beyond this call. But Catherine, I see your hands up, and Ramona. So it's Catherine, then Ramona.
Yeah. Not, what's the word? I'm not trying to be rude or anything, but I hear people talk and people saying why, cases are on the rise and what's causing cases to be on the rise again, and different variants is coming in. And a lot of people are saying a lot of it is coming from people coming in from different parts of the world. As far as people being let in and just them not having access in their country to certain healthcare. So they come in, sometimes that's the reason why they come in here, because the healthcare too, is better. And, which I don't blame them, especially when you have children, as a mom. But, what do they say on that? Like, what is I'm trying to think of the word. Like, what, you know what I mean? Like, is that some of it? Can that be some? Not 100%. Like, oh, it's the migrants bringing it over. No, it's, people got to take care of themselves too and clean and all that. But is that part of it? Like, can that be like a small percentage of it? Like, them not knowing they have it and they're coming over here. The English might not be too good. They can't find health care right away when they get here, But I just want to know, can that be like a small, you know what I mean? Ayana, is it?
Yes.
Yes.
Yeah. I'll chime in on that, and then I'll let Marky or Jazmin jump in. I think that
Okay.
that kind of speaks to a lot of things that we talked about tonight, right? I think one, when it comes to barriers to accessing care, that one, a lot of times we see that there's hurdles with language, right? We understand that Boston is very diverse, right? We have people who speak a number of languages, whether it's English, Spanish, Cape Verdean Creole, Haitian Creole, Chinese, Vietnamese, Russian, and on and on and on and on and on, right? We have folks from all over that come to Boston to live and to navigate and grow, right? So one, I think when we're talking about making sure that our communities are well, our health care systems some are doing better than others, right? But one, it's about making sure that we're doing it in a way that people can receive the information, right? Because if I come into your community and I know your community is predominantly Haitian, right, and speaks Haitian Creole, but I'm giving you information in English, I don't think that's necessarily fair or correct, right? How are you providing care in a way that we can't even communicate with the folks that need the care? So that's one, right? And then two, I think that we see with, not understanding people's cultural understandings of medicine and maybe meeting folks where they are, meeting them where they are with those apprehensions of even getting seen, because I know that it could be that the message today is that folks are coming over here for care, but at the same time, are we showing up in a way that folks can we're being culturally have enough cultural humility to treat them the way that they would need to receive the information and trust the vaccination or the treatment or anything like that. And then I think that also kind of, when we think about racial equity in all of this, right? We understand that some folks have attitudes about, folks coming over. We want to just kind of blame it on, disease spreading on, migrant crisis, everything like that. But I think it just speaks to the larger issue of us not getting to know who needs the care and how we can make sure that we're giving efficient care for our residents, period, whether you're whether you've migrated here, whether you've been here for generations, right? I think care is care, right? Because if I'm just caring for some people who have access to insurance, who speak English, who can pay for it, right? and everyone else is still sick, I still have the opportunity to get sick. So I'm about healing all the way around, right? So I think it's a very layered discussion, right? And I will say stay tuned, because I know we're gonna definitely have more community convos about stuff like this. But for me, I just think it's about making sure that we're addressing the why and the how people get care, so that way we can make sure that the community as well and do it in a way they can receive it. So that's my that's my soapbox. But I'll let Marky or Jazmin chime in.
I just want to add a little bit. I have heard some of the conversations going on about the migrants who have arrived. And to me, I feel like now our work is to address that misinformation and to just make sure that we're checking our resources and not putting blame on different groups, because we don't want to divide each other. We need to work together in order to address some of these health inequities. Are the rates high right now? Yes, but we don't know what specific demographic is leading to the rise. And then, as even in the presentation, there could be many reasons why there's a rise in the rates. There could be different factors that impact it, but I wouldn't signal out one particular group. And so I feel like I'm gonna work on trying to address some of this misinformation, because I know that some of the Boston Health Commission, they're working on different initiatives to get some of the migrants vaccinated, because there was a measles outbreak on, I think it was like kids. It was like the younger age group. There was a measles outbreak, and then they had to come in and vaccinate them right away, because we don't want that to spread, because that's, dangerous. And so they are trying to address these things. And I think BMC is also taken in some new arrivals. And so they have some initiatives in place. It's just, at least for our hospital, it's a lot. There's a lot to manage. And so I just know there's a lot in the process that they're working on. It may be slow, but they're definitely thinking about it and doing something about it as well.
Thank you for that. Marky?
I don't think there's anything more I want to add. Ayana, you said it perfectly. How do we make sure the healthcare system is equipped to prevent the spread? Jazmin, how do we prevent sort of the spread of misinformation that certain groups are responsible for the rise in COVID cases? I want to just add one last thing. The majority of public health research, because I am studying public health, show that community transmission levels within a country actually play a more significant role in overall case numbers. And there is tons and tons of research on community level transmission and the dynamics of local transmission, for instance, community spread, and how public health responses within a country have influence on case numbers than crossing borders alone or travel. So that's just one tidbit of scientific information I just wanted to push out there. But thank you both. It's so amazing to be part of a panel with such intelligent and articulate individuals. Wow.
Awesome. So, all right, I see one last hand. So we're going to go to Ramona, and then we're going to close it out for the evening. So Ramona.
So Catherine and Ayana, you everything that I was going to say, you all hit it on the nail. But my concern is, I'm in Mattapan a lot, and I'm picking up the trash and all that stuff that's on the streets and everything, because it looks nasty in Mattapan. But I was thinking, because they have a center for Haitian Creole immigrants and stuff to come to learn what the resources and stuff. But my concern is, because they can't understand English and stuff, why can't they get flyers in the resource center there? So it could talk about COVID, it could talk about the vaccines, it could talk about helping getting a PCP or something like that. I'm kind of concerned about that because, like I said, they're everywhere in Mattapan, everywhere. And, and it's like, the other day I was down there and they were selling phones on the streets and everything. And a couple of cops came over and say, "Are you all selling these phones for the government or are you doing it on your own?" So they were saying that they was doing it on their own. So the cops said that they couldn't do it. But I think the communication with the immigrants and stuff that can't understand English, it needs to be changed a little bit so it could be all languages that people can understand it. So that's my concern. So thank you for listening.
Yeah, thank you for bringing that up, Ramona. I think it's really important, right, that we make sure we're able to give information and not just give the information, right, but think about the entire journey of getting the information, going to said clinic or hospital, talking to the doctor, getting the medication or the vaccine. Like that's like there's multiple touch points, right? So I think if anything, our long COVID project, and we've seen this through the community, right? That it's not, it's about making sure that information is in multiple languages, but that we're making sure that each touch point has that language access available, right? I think that's really important. But I know, Jazmin, with you working in the health system, kind of wanted to give you space to also jump in on that.
So I know that a lot of, I want to say, different research programs and even the hospital staff, they're trying to get materials translated in different languages. It does unfortunately take some time. And for our project or for MA-CEAL, we do have some resources in Haitian Creole, in English, in Spanish, some even in Vietnamese, in Mandarin. And so it's really based on the need. And so if you know that organization who's doing that for the Haitian migrants, and if you want me to share some of these handouts that are in Haitian Creole, I can share them with you as well. They're also on our website. And so it is something that a lot of, especially for BMC, they have a large population of Haitian Creole. And so they're definitely trying to get everything translated in that language, along with, Spanish and English and possibly, I want to say Vietnamese, based on the population. And so it's sometimes a second thought for most programs for research, but I'm definitely, at least for me, I try to push for it a lot, because if we're really about people, connecting with people of color or the people who are most affected, then we need to consider language like all the time and not as a second thought. And so there's definitely people who are trying to push for it. And so if you need it, just let us know, because if we need to get it done, we'll get it done.
Ooh, all right. So thank you, Ramona, for that. We appreciate you bringing that up because, again, we all agree with you. It is very important. So, all right, we're at 8 o'clock. So I feel like we could do this all night, right? But want to make sure that we give an opportunity to give you both kind of like final thoughts, so that way we can kind of close out for the evening. So Marky, I'll let you go first.
Sure, would love to. Final thoughts for the evening, really. Just want to remind folks, if you're not vaccinated or don't have your booster yet, please get your booster. Please get vaccinated. It's the best way to prevent getting COVID and the best way to prevent getting long COVID. And for any new COVID-19 infections, get treated if you're eligible, ask for medical help, follow through with your doctor's recommendations. And lastly, stay informed. Listen to credible news sources, do as much research as you can, but most importantly, don't hesitate to ask questions like you did today. Really impressed with how much engagement we've had with all of you folks today. And yeah, just had an amazing time. Thank you so much to Ayana, Ariel, the Vital Connections team for giving me this opportunity.
All right, Jazmin, any last thoughts? And after Jazmin goes, don't run off yet. Like there's some things I want to share with you before you go. So it only takes 2 seconds, I promise. Just letting you know, just don't hang up yet. But Jazmin, go ahead.
I just want to thank everyone for sharing their questions and participating in the discussion. I think the only way we get somewhere is to just have that discussion to begin with. And so I really love this way of doing it. And so I really appreciate everyone who participated, everybody who put something in the chat, because we learn from each other. And so I really appreciate it. I feel like I just learn a lot from what you guys are thinking. What is the community thinking on the ground? And this gives me a lot of insight on a lot of the things that we need to work on in the future so that, we're able to address everything that is needed, at least at this time, step by step.
So Marcky, Jazmin, thank you so much for your insights, for your wisdom, for all the work that you do. Again, I have hope in the future because I know that you all are working hard and connecting with community and trying to create space for us all to be a part of the solution. So again, thank you for all the work that you do. So, and thank you for joining us tonight. I will say, folks, I'm very happy that we, our first community convo back for the season. We've got 71 folks still kicking it with us. So thank you for listening, giving your insights, sharing your stories. I know that there's some folks in the chat who have shared things that there might be questions that we might want to get answered or do a little bit more digging because we didn't get time to get to it tonight. We're all going to make sure that we kind of do that to figure out how we can connect you all to what you need. I know after this is over, we're going to, get the recording, put it up per usual and share it out with you all. So please share these resources with your friends, your family, your coworkers, your community, because it's really important that we share this information, right? That was part of the conversation here. Some folks are not getting it. So I think we can all be COVID ambassadors for our community by sharing this information so we can all be well. Speaking of being well, I know Marcky had mentioned it in the beginning, but a part of this work is to better inform our community of our community health hubs. And I wanted to share something really great with you because we're kicking off our fall community health hubs. These are great places that are in the community that you could talk to different community organizations, healthcare professionals about how to lower risk for diseases. And we've got a really cool program coming up this Saturday called Walk with a Doc. I'm going to share my screen and show you the flyer. But Walk with a Doc is a great opportunity, and it'll be happening this Saturday. We're working with a great doctor named Christine Tadese. If you've been to our community convos, she was here in January to talk about community wellness. And what she'll be doing is every Saturday at the ADSL field in Fields Corner from 10 to 11, she'll be taking a walk with community members and talking about different health topics. So this might be a really great opportunity to get going, get active. I know I need to, but you could talk about different things. I know she wants to talk about mindfulness, about nutrition. I know there's going to be one about cancer and cancer prevention and getting screened. So there are a lot of great topics that'll be happening on Saturdays. So again, the first one is going to happen on this coming Saturday, the 21st at 10 o'clock. So I would love to see you there. And then with our community health hubs at large, we have a lot of great community partners, as you can see on the flyer here, that offer different supports when it comes to food access and nutrition, getting your body moving, reducing stress, and connecting to clinical care so you can get screened and know what's going on with your body so we can all be well. So I just wanted to share this here. I'll be sharing it with you all via email with the follow-up. So that way, if you want to come walking with me and Dr. Tadese, feel free to join us. But otherwise, please feel free to fill out the survey in the chat. I'll drop it one more time. This is the way that we get to know what you want, and that we can know how we're doing, what do you want to learn about, how can we better connect you to the information that you need. So please feel free to fill out that survey, and we look forward to seeing you next month. So with that, everyone, take care.
Good night and thank you.
Yes, good
Blessings to
night.
all.
Good night
Good
and thank you.
night.
Have a
God bless
good
you
night.
all. Have a blessed evening. See you
Good
next
Good
night.
night and
month.
thank you. Everybody have a good night.